everyone, welcome to week 8. This week we're going to be covering chapter 10, which is all about pulmonary drugs. So pulmonary drugs are drugs that are used with the respiratory system. So we're going to look at a lot of different medications that are used with the respiratory system. And when we talk about that, we mean the bronchi, the bronchioles, and the lungs. So here's just a quick little picture of what we're talking about. So anything in this area is what we're going to be using this particular class or group of drugs for. So it could be something like asthma, bronchitis, COPD, any type of bacterial and viral infections of the lungs. All of those things are going to be treated by using some of these different medications. So let's take a quick peek at some of the categories. I'm just going to highlight a few of them. There is a lot of material in this chapter, but I just want you to be familiar with some of them. The first category, probably the most common category, is the bronchodilator drugs. These are used for asthma, COPD, emphysema, things like that. And the way they work is they relax the smooth muscles and allow them to dilate so that you can get more air. So anyone who has ever experienced asthma probably has seen someone or had themselves a rescue inhaler. And typically the rescue inhaler that a lot of docs prescribe is Proventil. So here's an example of what it looks like. There's a metal canister, and it's like an L-shaped plastic tube, and then you've got the mouthpiece. Now sometimes there will also be an extender on there that actually allows that the medication to be dispersed a little bit more evenly into the respiratory system. So, but again, this is one of the most common ones that you're going to see. And the idea is that it relaxes some of those smooth muscles. Now, you notice we have this HFA on here. We used to these used to be propelled. In other words, that's how the medicine got from the canister into the patient, using what we called a CFC, a chlorofluorocarbon. But it was banned several years ago now. It was considered a pollutant, and so they changed the propellant. So that's what the HFA refers to as the propellant that's used to push that drug into the body, into the respiratory system. This is another example of an inhaled device. This is a disc, and it contains another bronchodilator. In this case, the drug is called salmeterol. Ceravent is the brand name for it, and it contains 50 micrograms of medication in each inhalation. Another category is called the corticosteroid drugs. Corticosteroid drugs are basically suppress the inflammatory response. So they're going to reduce inflammation. They're going to reduce the edema, the swelling, of the tissue that's associated with asthma and things like that. They don't dilate the bronchioles, so they're not typically used for the rescue inhalers. So these are more preventative medications. Here are some examples of them that you might see. We've got Pulmicort, which is a pretty common one. Flovent is another one. Asthmanex, Asthmacort, those are some of the common ones that you'll see. And this is just a picture of what you might see them looking like. So these are, again, inhaled doses that a person would take on a regular basis as more of a preventative. Then we also have combination drugs, so things that include one or more drugs put together. Advair is an example of a bronchodilator that also contains a corticosteroid, so it's got both things in it. There's a lot of inhaled devices that you'll be seeing coming through the pharmacy, especially in a retail setting. When you see those, we actually measure those doses in what we call either puffs or inhalations or even actuations. Those are some of the terms that you're going to see. And basically they all mean the same thing. So we just have to make sure when we are translating the words into the directions for the patient, that we make the words something that they understand. So puffs, inhalations, things like that are a little more understandable than the technical term of actuations. So you're going to read a lot more about all of these different things and the ways that these drugs are administered. There are some oral medications that are used as preventatives. And then you're going to look at a few diseases as well, like tuberculosis, Legionnaire's disease, things like that. And finally, you're going to look at expectorants. You might be, I always find this commercial funny when I see it. The ones with the mucus. So that's what we're talking about when we talk about the expectorant. We want to get rid of that stuff. We want to cough it up. And then finally, we're going to look at things that are used to stop smoking, because again, that affects the respiratory system. So we're going to look at nicotine drugs and other things for smoking cessation. How to treat patients who are even on ventilators, because again, we're dealing with that respiratory system. So if you have any problems or questions this week, please make sure you reach out to me. You may call, email, or text anytime. My number is 618-792-2293. Have a great week.